Hi, my name is Tanya Snyder, and I'm a clinical supervisor at the Interface Referral Service at William James College in the Friedman Center for Child and Family Development to talk a little bit about how we help families and children navigate access to outpatient mental health services. Our mission is to provide resources and referral guidance to outpatient mental health services. We work with children, families, adults who live or attend public school in our subscribing towns. We also work with mental health professionals within or around our subscribing communities as well. Because I'm here to talk about children today, I wanted to talk a little bit about the prevalence of mental health issues in youth. We know that about 10 to 20% of children and adolescents experience mental health disorders, and half of mental health illnesses begin by the age of 14 and 3/4 by mid-20s. We know if left untreated, these conditions severely influence child's development, educational attainment, and their potential to live fulfilling and productive lives. So our goal is to help navigate them to outpatient mental health resources to prevent some of these issues. We also know that there are some barriers to obtaining mental health. There's stigma, there's also sometimes long waiting periods, some confusion about where to go for services, feeling like it's a hard process to engage in terms of time to find a provider or attend services. While we can't create what doesn't exist, what we do is help clients navigate through the hurdles and spend the time needed to get through them to outpatient mental health resources. So we know where to go. As I mentioned, we have a database of over 9,000 licensed and vetted providers. We also know who has availability or when they might have availability upcoming, and we work to find the shortest wait list option, if that's an option, or even providers with current availability where that exists. We also think about creatively with the caller about time to seek treatment. Could we be creative about early morning or later in the evening or a midday lunch break or possibly on the weekend? And with the advent of telehealth, that's created some additional ability to navigate through that barrier. In terms of our process at Interface, as I mentioned, we have a database of over 9,000 licensed and vetted providers, which we recruit when we enter a community, but we also continue to recruit throughout our process. In terms of a caller, they would call our helpline Monday through Friday between the hours of 9 and 5 at 888-244-6843. We would do about a 20 to 30 minute intake over the phone. What we're gathering is some information about themselves or their child or dependent's mental health struggles. We're asking about locations they may be able to get to when we're meeting with providers in person in the future. We're also asking what time works for them for an appointment, what type of insurance they have, and if they would like to self-pay, what kind of fee feels feasible for that to occur. At the end of the intake process, we're going to assign the caller a confidential code, and that will be how we refer to the caller and how the caller should refer to themselves as they're scheduling appointments. Within 2 business days, that caller will be assigned a lead counselor. That lead counselor will reach out to the caller and indicate that they're beginning to work on their case in terms of finding matches to providers. They will also then begin looking at our database to find providers that match on the criteria discussed at the intake process. And when they reach out to providers, which we'll talk about here in step 4, they will present the case to providers using that confidential code. They will never talk about the caller in terms of name, date of birth, street address. No identifiable information will be shared with providers. They will just share what they're looking for therapy, what kind of issues that they're struggling with, their availability in insurance or self-pay requirements so that we can find a good match. In terms of returning to step 3 here, we provide guidance throughout the matching process. So we may provide some guides on our website in terms of how to choose a provider, what to expect during your intake session with a provider, etc. We also might be talking about where we may negotiate on some of the matching criteria to find a match sooner or a more agreeable match in the long run. I already talked about step 4. In terms of step 5, we follow up with the family or caller when we have a potential match. We call them to let them know who that provider is, how to contact that provider. We also call about a week after we provide that match to ensure that they were able to connect with the provider, and if so, when they might have scheduled to see that provider, so then we can follow up after a session or two to ensure that the provider was a good fit. In terms of number 6, following up with the provider, a provider may call us with additional questions about the case to ensure that it's a good fit, or questions about insurance to ensure that they can provide services for this particular client, and so we will occasionally have some follow-up contact with the provider as well. We close the case on our end when either the caller feels like they're connected to a good match and they no longer need our services. They were able to get to services through a different means. Maybe their PCP or a neighbor helped connect them. Or maybe they've decided they don't want to pursue services at this time, and they may share that with us, or they may stop returning our phone calls, in which case we may close their case as well. As I mentioned, we match to providers using the following criteria: their specialty need that they talked about during intake, their availability, their insurance or fee requirement, and their location. We respect the caller's voice and choice, so we aim to provide matches based on as many of the criteria as we possibly can match on provided at intake. And again, we negotiate with the caller if that's not possible to find out which ones might be their priority. We respect their concerns for confidentiality, again by using that confidential code and never providing any identifiable information about them to providers without their consent. We aim to provide at least one match as quickly as possible. However, at times, depending on what's going on and how busy providers are, as well as the criteria at intake to match upon, it can take us up to 3 weeks to find a match. We're in communication around when it's taking us a bit longer, again, to negotiate maybe on some of the criteria or to just update the caller on where we're at in the process. And we are committed to the value of follow-up. So what I think makes Interface stand out is we don't just provide a list of potential options, it's a curated list of matched options. And not only do we make sure it's a match, we also make sure that it's a good fit. So we know that on paper, a provider may check off all the boxes, but when you meet with them a few times, it doesn't feel like a good fit. So we want to make sure that it feels like it's a good fit for the caller. We believe we must empower callers to advocate for and understand the therapeutic process. So we want them to feel like they can talk with their provider, negotiate through maybe a desire for a different type or style of treatment, or where they want to start in their work with a provider. So we talk a lot about how to navigate that process and want callers to really feel empowered to be able to do that. And we know and demonstrate that access to care is part of care. We know that callers have spent a great deal of time often trying to find this match on their own and either not getting calls back from providers or hearing back from providers that they don't take their insurance, or they don't see that particular age group, or they don't treat that particular issue, or they don't have a current availability. And we know that they've repeated their story often many times to hear no, or to hear no response at all. So our goal really is to help them navigate through that system in a way that feels much more empowering and empathic in the process. This is a bit of a snapshot of our website. If you look under the About tab, you will see a couple of research studies that talk about the efficacy of our work. Under the Communities tab, you'll see all of the communities that we serve listed. On each community page, you'll see local resources, as well as our flyers, which can help explain how to access our service, as well as what to expect when callers call us. Under mental health topics, we have a variety of very readable articles about mental health topics, as well as local and national resources. There's the Guides tab that I mentioned, so we have a lot of guides that explain the initials behind our names, and how to ask providers questions and what to expect your first session and all of those kinds of things, how to choose a provider. We also have publications listed there on a variety of mental health topics, and we have a Great 14 section as well. I do hope all of this helps you in your work navigating to help families find outpatient mental health services, and we do hope that we can be part of that journey for your families that you work with as well. Thank you, take care, and have a great day.